The healthcare theory that supports the relationship of inputs and outputs is a self-care deficient theory developed by Dorothea Oram. This is a theory used by nurses to guide and improve practices. It's comprised of three parts. The first part is self-care, which is the practice of activities that an individual initiates and performs to attain life, health, and well-being. This is especially important in mental health nurses because they provide services that can be emotionally draining. So for this theory, it is important that they understand that there are several sectors of self-care. This includes the self-care agency, the therapeutic self-care demands, and lastly, the self-care requisites. The self-care agency is the ability for a person to engage in self-care by developmental states, life experiences, social cultural orientation, health, and available resources. When we discuss available resources, the plan for outputs is that we create trainings so that nurses can learn mindful techniques, deep breathing techniques, so that when they feel overwhelmed, they can incorporate stress reduction within themselves so that they can help the patients that they're providing services, and that they decrease the amount of feelings of depersonalization or losing compassion for our patients. Therapeutic care demands is a total self-care action to be performed over a specific duration of time to meet self-care requisites. And self-care requisites includes the categories of universal development and healthcare deviation of self-care requisites. The theory of self-care deficiency is a theory that identifies 5 methods of helping, and that is acting for and doing for others, guiding others, supporting others, and providing an environment, promoting professional development in relation to meet future demands, and teaching another. This is important for this health, for the assumptions, because in the environment of mental health, patients require a lot of patience from the healthcare provider. When healthcare providers are self-deficient in self-care, they aren't able to act for others and do for others. So the healthcare theory supports this promoting of professional development and personal development to meet the needs of our patients. And lastly, the theory of nursing system describes how the patient's self-care needs will be met by the nurse, the patient, or by both. This identifies 3 classification nursing systems to meet the self-care requisites of the patients: wholly compensatory systems, partly compensatory systems, and supportive education systems. The assumptions of the healthcare theory is that nursing is a form of action, it is universal and development self-care requisites, and it's important in primary care prevention and ill health. Knowledge and potential health problems is needed for promoting self-care behaviors and self-care independent care for behaviors learned within socio-cultural contexts.